Welcome to the Neuromodulation Podcast, presented to you by the International Neuromodulation Society. Dive into the forefront of today's emerging neuromodulation techniques, insights, and ethical and clinical applications. Subscribe now to join the multidisciplinary collaboration of medical care providers, scientists, and engineers who are part of the global conversation that's shaping the future of healthcare.
Hello and welcome to our INS podcast. The topic today is going to be, I think, a very interesting one. Our topic is what it takes to run an academic neuromodulation and pain department. And to answer that question, who could we have but Professor Frank Huygen from the Netherlands. Frank, welcome along.
Thank you for the invitation.
Our pleasure. So if I can kick off and ask, what are the requirements typically to be a departmental head?
Oh, that's immediately a difficult question. If you look at the responsibilities, besides the fact that you have to be a doctor, because that's where it all started, to be a physician, that you have to manage the department. In the meantime, I started somewhere in time with 3 persons, but in the meantime we have 50 persons working. So that's also a lot of people management. But of course then, in the academic position you also have education and training, and you have the science, the research, of course. So it asks a lot of different competences to do this job. And of course it develops. You start little and then you learn, and step by step you are in the end responsible for this.
So how typically would your work week look divided up into the different components?
Officially, I have 1 day for management, I have 2 days for patient care, and then I have 2 days for research. But in the reality, everything is mixed. You're constantly involved in patient care because people ask you, you are constantly involved in research. It also asks a lot of hours in the evening and in the weekends.
Yes.
It doesn't fit in a normal week.
It's not a 9 to 5. No, I've gathered that. So you obviously know the Netherlands set up intimately well, but are there differences across Europe on how departmental heads are run in academic departments, or is it fairly uniform?
As far as I can see, it is uniform, although I think nowadays we see also changes. You see that in each area there is a lot of professionalism in the way that the requirements are rising. And it's really the question if it's future-proof to continue in this way. If I compare to when I started 20 years ago and nowadays, what are the requirements? The requirements, if you look at quality of care for patient care, if you look at what you have, how research is performed, there's also a lot more requirements and a lot more knowledge necessary to do the research in the right way. But also in education. In education you also see that there is a lot of professionalism. And so it's really the question if we can give one person all these responsibilities. And that's what I little by little also see around me, that if people from the past century like me are, when they retire, that they don't give all these responsibilities anymore to one person, but they try to think, how can we split these responsibilities?
So if one is progressing through the academic ranks, how does one get the expertise or training to ultimately end up with taking on a role like a departmental head? But
it was not in an organized way. If I look at my personal growth in this area, then of course I did courses for how to do science. I did a PhD, so I learned from my professors how to do it. And if you look at, for example, management of a department, then I also did courses. But I also was very well helped by time hiring a coach. And so that you can reflect about what you are doing. The point is that sometimes you are really alone as a department chief, and sometimes it's also difficult to communicate everything with the members of your department, and then having a coach makes it safe. And I once in time, but then I'm speaking 2006, 2007, I had the opportunity, I was so lucky that I had a coach on the job. So they hired someone who 3 months walked with me every day. And that was the period where I really learned a lot.
That's a luxury.
Yeah, that's really luxury. I'm privileged on this point. But that was the point where I, for myself, also felt a big change. That's a big change in that I could see everything more with a helicopter view. Yeah, try to organize all these different responsibilities you have.
And I've talked to quite a few CEOs, and they've disclosed that they have coaches on how to be CEO of a company, which I didn't really appreciate. Could you just tell us a little bit more about what is an interaction like with a coach? How does that actual process occur?
Yeah. Now, first you have to have a good fit with your coach. That's important. That's so on the moment that you decide to be coached, you have a first meeting and you speak about the expectations. And then if there is a personal fit, because it also needs a lot of trust. On the moment that you bring a personal problem on the table where you're struggling, then it helps that you have a personal fit with a coach.
There.
Yeah, absolutely. And it's confidential, of course, always. And I also had the experience with the coach that I had not the same fit, that we were not on the same level. But then you must say goodbye to the coach. But especially with the coach I had during these 3 months, that she really also learned me how to deal with, for example, the board of directors of the hospital, and not to be afraid for your own position, because that was always a little bit in the background that you thought I have to grow and I have to be careful. But it's not about you, it's about the position. That's what you have to take in mind. Yeah.
That's really good insight. In terms of the PhD pathway, you mentioned that earlier. How important is that PhD pathway to actually taking up a job as an academic neuromodulation or pain? And if it is important, is it better to do it earlier when you have energy but less experience? Or is it better to do it later where you have more experience but less energy to complete it?
For me personally, it was very important. There are many reasons. My medical school was in the last century. That was a time where there was not much attention for evidence-based medicine. It was more what the professors thought that was the true. And now in the meantime, we know that is a little bit not the case anymore. So for me, learning what evidence-based medicine is and learning how to do research as a PhD student and learning to do this in an independent way also gave space to that I can, in my position now, give guidance to new PhD students. I had this discussion with a lot of people because I still have a lot of colleagues who don't believe in the importance of a PhD. But also there you see a little bit of time shift. You see now that medical schools also improve and also become more scientific, and that I'm sometimes surprised that my students already know so much about research methods, about all the aspects you need when you nowadays go on PubMed to make a search question. They have knowledge about how to measure the quality of the science. So they are much better trained. That was a part which I learned during my PhD student period. But so maybe it's also a little bit shifting. To become a professor in the Netherlands, and we have this system of assistant professor, associate professor and full professor, it's necessary that you have a PhD. That's obligated by the university.
And the timing of it, do you recommend that people do it early in their career or a little bit later in their career?
I did it later in my career because after my residency I went to a general hospital. I worked there for 5 years. It was really a pleasure. It was good to learn how to be a doctor, and then I decided to go back to the university, and then I did my PhD. So I was a late PhD student. That has of course disadvantages because in the meantime I already also had a family, a mortgage, so I also had to earn money. So my PhD was especially in the evening hours and in the weekends. So from that point of view, you would say do it as early as possible. We now also have this young PhD students, when they finish medical school, they first do a PhD and then they start their residency in anesthesiology and then hopefully in the end pain medicine. You see differences. If you already have clinical experience, that's also something you take into your PhD.
As an academic departmental head, was the job different to what you thought it might be?
I had no idea. Yeah, of course you have an ID because you have, and I was trained also in a university hospital, so I knew how my professors acted, but they save you a little bit from what's really happening behind the door. As a resident, you get sometimes a little bit, but it's mainly focused on that you learn to be an anesthesiologist, that you learn to be a pain specialist, and everything which is around, you are a little bit protected for that. So the first time that you really see it is when you take the responsibility. Then you start realizing, okay, this can also happen.
Yeah. Are there specific elements to running a neuromodulation department that you think are different to running an anaesthesia department, an intensive care department? What are the specifics around neuromodulation that reflect on what you have to bring to the job or to the table?
Yeah, if you compare it, for example, to an anesthesia department is a facilitating department. They have not their own patients, they are facilitating the work of surgeons. As a head of a pain department, patients come to you, so it's a different world, and you are in the end responsible for the decisions, and you also are responsible for arranging everything around it, like going to the OR. So it's a different job. That sometimes also in my department is still part of the anesthesia department, but that sometimes also gives discussions with the head of the anesthesia department because we have different responsibilities.
So if you tried to break it down into components, I guess there's a political component to the job, there's the people management component to the job, and there's the conducting the research component to the job. Can I ask you to comment about those? What is it like trying to deal with the political aspect of the job?
I like challenges. I like it. It's not always nice, of course, and you have to realize that you are in a very competitive. There's always not enough money. That's where it starts.
One problem.
Yeah, and that means that you're always in a competition. But try to play on the ball, not on the person. That's an important message. If everyone realizes that you have to play on the ball, then in the end you can be friends again. That's very important. I always keep that in mind. It's something I learned from one of my coaches, that don't play on the person.
The people management aspect. I run a private clinic and then obviously at the university as well. And I think at the private clinic, the people management is the most exhausting part. I'd rather see patients any day of the week than deal with the issues of the staff. How do you go about the people management aspect? It's not intrinsic to what we've learned as doctors.
No, absolutely, that's correct. Yeah, it's also a little bit what you expect, I think. I always say I'm not the trainer of FC Barcelona. It's not that if someone is not super good, that you immediately have to go out of the department. That makes life already much easier. It's always a Gauss curve. You have people who are at the top, you have people at the bottom. And what you have to realize is that the people at the top, somewhere, if you don't go out of the department, they go out of the department because they are so talented and you are maybe taking too much space, so that in the end, but that's good. That's how it has to be. At the lower part, there is a part where you can say, okay, everyone can have in his life a period where he doesn't function optimal due to disease or due to private problems or whatever. So I want to accept in a certain limit that people have a short period where sometimes you are at the bottom. But if you are constantly at the bottom, then you also have to deal with that. And especially in cases of if safety and quality is in danger, then I also made firm decisions. And I never regretted that decisions, but it's not feeling very nice. And I also said goodbye to people who I liked as a person, but who did not fit in the department. And you get room to improve, you get feedback, we help you wherever we can. You can get the opportunity to have a short period where it is, for some reasons, less as expected, but if it's continuous, then you have to say goodbye.
How do you protect the research? Because with all these pressures, the patient pressure, which tends to be the most forefront or the most obvious, how do you protect to make sure that the research still happens?
For me personally, I arranged it already many years ago that I have one day that I'm not in the hospital. Then, because being in the hospital means that you are involved in everything. People in my department very easily ask me questions. So one day in the week, normally I do it on Friday, that I'm at home. And everyone knows that I'm at home and they know that I do a lot because that's the moment that they get their reviews on their manuscripts. So it's also not a discussion point, and everyone knows that only if really necessary that you can disturb me. And I did this due to the fact that still I have to put in a lot of time in my evenings and also in the weekend, but a little bit for protection of my private time. I'm still with my wife, my first wife, so I succeeded to do it in the right way.
Then you're doing it very successfully, Frank, very successfully indeed. Which brings me to the point of balance. You've obviously mastered the art of finding the balance in something like this. Have you seen others that have struggled to find the balance?
Absolutely, and it's more and more also a problem of the new time, and we have to find a way how to deal with this. What I more and more see is that especially the younger members of staff, they are very keen on their balance in private and work. And more I see that they don't want to do all these things at the same time. But it is, you have to expect or respect this. For myself, I didn't know better. We learned that this was normal, that it was expected.
Yeah. I used to be rostered. I remember working in England, I was rostered 84 hours a week.
Yeah.
Rostered.
Yeah. I remember that I went into the hospital on Friday morning and came out at Monday evening, and then you hope that you had a few hours of sleep. Yeah. But I think that you can't expect it anymore from people nowadays, and that's a little bit maybe also the same with finding a balance between all the responsibilities. I understand that there is more, and I also respect it.
For you, what is the most fun aspect of running a department?
Yeah, it is not one thing. It's maybe the total of bringing a department further, making it future-proof. That's in the end the ultimate goal, of course. And I enjoyed a lot of things. I still enjoyed to do an outpatient clinic. I still enjoyed to do a surgery, the implants. I also enjoyed to give education or being involved in guiding the PhD students. So it's difficult to choose. Maybe if I look back, the most exciting things were the innovations, and especially if an innovation is successful. If I think about, now we were both involved in the first implants in DRG stimulation, great positive energy giver. The same for me with hospital nerve stimulation in cluster headache. Yeah, this therapy is so successful. It's in my hands the most successful therapy I applied during my career. That gives me energy. If I see a positive patient on my outpatient clinic, that gives me energy.
And I think you semi-alluded to it, but I think one of the things that allows you to have balance is to realise the department is not, you do not own the department. The department will exist long beyond your own professional career. And if you can take it and make it better and leave it, you have done a good thing in life. And I think having that approach, I think, can also decrease stress.
Yeah, I had a sabbatical about 3 years ago where I left the department for 2 months. I also was not available by phone or whatever. I did not check my email. I did nothing. And that was a good proof that it works. The department was still there and I came back. And one of my worries, really, if we have to talk about worries, during the last 1.5 years was I will retire in about 3 years in my academic position, because I expect that I will continue parts of my work, but we have to retire. That's by law, it's obligatory that we have to do this. But one of my worries was to find a successor. And the university is very strict about what they ask if you want to become a full professor. You need at least 60 as a first or a last author. You need to have finished at least 5 PhD students. You have to show that you at least bring in 200 to 300,000 euros a year from outside into the department, and your research also has to be viable for the society. So you have to show that you have influence on guidelines. Now, there are people who can do all these things, but for new people, this is really a big step. And so now the world was almost too small, but looking around, we identified someone, and that's for me really a big thing that it will continue and that it will even become stronger. I believe that my successor will again bring it on a higher level.
You know, looking over the decades, I've seen people groom a successor over 5 and sometimes 10 years inside a department, and that has often worked very well, but sometimes not. And then I've seen also people bring in an outsider, sometimes from another country, into it, and I've seen that work well and sometimes implode and go very bad. So what are your comments on how to get the right fit of person?
That's something I really thought a lot of, because of course you need these basic competences. That you need to be a pain specialist, you need to have a PhD, you need to have shown that you can do it. But besides all these things, which are quantifying, there are also some aspects which qualify you for the position. And I think one of the most important things is that you have to be eager. You really have to, if you don't have a stip on the horizon, if you don't want to go for it, I sometimes see it as the Olympic Games. There is only one thing you can do. You can run very fast or you are not in the game. Yeah. And if you can identify that person, and you can a little bit quantify that, because if they already have more than 100 papers, if they already have finished PhD students, of course, that there is a reason for that they did this. But if you look at the characteristics of someone which make them fit for, is that they want to go for it. It also can be a fall trap, of course, because if someone goes for everything, it's also not manageable in the end. Yeah. So there also has to be some balance. People management is very important. I think that you never do it alone. You always do it in a team. It took me, they asked me several times to transfer to another university. Another university asked me if I was interested in a position in their place. And one of the biggest hesitations was that I thought, but I go alone. On that moment in time, I had strongly the feeling that I could not do it without my team. Yes. That now I'm on an age, but now they don't need me anymore maybe, but now I'm on an age that I think I could do it. I have enough experience, but that's a little bit also about growing.
Yes, yes. I've seen in hospitals, not academic centres, but just in hospitals, where they have split up the head to now a bureaucrat that is the head, and then separately a clinical person. And almost inevitably, the bureaucrat takes control and starts dictating clinical terms, and the quality of care goes down. Is there a risk, as you say, if the job becomes so big, it's impossible for one person? Is there a risk that we end up with that scenario in academic land?
Yeah, we already see that is happening, and I think that is the wrong way. I think that in the end, a university hospital has a lot of responsibilities. It's not only about patient care, but it's also about research and about education and training. But in the end, I think that patients come to the hospital for a doctor. They never come for a bureaucrat. Students come to learn from doctors. They never come for the bureaucrat. So I think that we have to find a way that we are helped by the bureaucrats in doing our responsibilities in the right way. But it's not a good case if they take over. In my case, where we now decided that after my retirement, that there will be a separate head of the department and a professor, then still the head of the department will be a pain specialist. We don't go for a bureaucrat. No. Very important, I think.
And I 100% agree with that, having seen what I've seen. When it comes to the research, it's possible to have a very focused research program. So our unit, we only do one thing. We're looking at monoclonal expression in, dorsal root ganglion, and we're going to do that for 10 years. And then there's other people that take a broader approach and say, how, with our resources, can we most benefit society? What is going to move the needle? And we'll have a broad approach. How do you decide what is the focus of the department going to be? You've got to attract and keep PhDs. They have to feel that it's beneficial for their career progression. And then you have to make a decision, do you go narrow, and this is what we're worldwide renowned for, or do you go broad? How do you view it, and how do you make a decision?
Yeah, we started with research on CRPS, and we were lucky in the way that we received an enormous amount of money from the Dutch government to do this research, so we could bring in several PhD students at the same time. And what we did is that we started to focus just on CRPS, and we studied the epidemiology, we studied the pathophysiology, we looked at diagnostics, we looked at therapies. I think that the CRPS is still a very important research line in my department. But in time I discovered, and especially when the support of the government stopped, because that was a fixed period, that you can wish that you stay only with CRPS, but sometimes you also have to follow the money. What is possible within the scientific programs? Where are the grants? And that's where I was lucky that was the time that DRG stimulation came in view, and I could make the combination with CRPS and DRG. And on the same time, we also received a grant for burst stimulation and to do research in CRPS. That's where we started to grow in what I call innovative neurostimulation. We started to publish, we started to get a little bit of reputation, and this is a field where there are still a lot of possibilities to get, because in the end it all starts with grants. And what was very important for me was that to organize it in PhD projects, because you need an owner for the project. Especially if you grow, in the beginning I could take all the responsibility. If the PhD student would fail, then I could take it over. But when you grow, and I have on this moment, now I always have to count, but I think I guide about 14, 15 PhD students, and they are in CRPS, they are in innovative neurostimulation, then you need ownership. You need to arrange ownership. I cannot do 15 PhD projects myself. And we always organize it in a way that one of my members of staff is also responsible, so we are always with two. So I have the end responsibility, one of my members of staff, and that are also senior researchers. They have co-promotership, so they are together with me responsible for one PhD student. And then they do the daily work and I do the supervision, and in that way we can organize it in the right way. But we had to broaden. We could not only stay on just one aspect, but on the other hand, I also don't want to go too wide. If there is someone who comes with a complete different topic, I would say that doesn't fit within. Also, if there is money, because you cannot take responsibility for it. It's also a big responsibility, taking a PhD student.
Yes.
At least I feel it as a big responsibility. There's young people early in their career, you want to finish it.
It's a well-known, I'll leave his name out, but a well-known American professor said to me, Mark, I'll give you a piece of advice. If you want to be successful in research, always follow the money, let the wind fill your sails. So I've tried to also follow that to a degree. Look, I might be showing my age, but a piece of advice. What do you do when you find students who are so more intelligent than you, that they're doing so complex things that you don't understand what they're doing, and then you're having to supervise them? I've had that personal experience. How do you manage that?
Now, we see that more and more. You see that, for example, artificial intelligence is coming in. I have PhD students working, for example, in MaxScan projects where the amount of data is so huge. These students have not a medical background, but a technical medical background. That's a new faculty in our university. So they also learned a lot about techniques. And they do things where I sometimes, indeed, my brain is not big enough to understand what they are doing. But on the other hand, on the moment that they start reporting, especially on the moment that they make a manuscript, the proof is that I at least understand things about what they did. that in artificial intelligence you have to accept that you cannot understand everything. And what we also do is that in that cases, then the co-promoter, so the second responsible, also has a technical background so that they have the overview. And they can say, yes, this is correct. Because in the end, that it remains responsible that we don't publish nonsense. That's at least what I feel my responsibility. And then for me, it's perfect. There's also there are also students which I can follow very well, but which are so brilliant that I am sometimes jealous. That I think, but that's the future.
That's right.
And we really try to keep those students connected to the department, because that's also the way how you can climb.
Frank, you have been so open. I think there have been so many pools of wisdom here. For people who want to go down this pathway, they need to listen to this podcast. Thank you so much.
It was a pleasure. Thank you, Mark.
Thank you.